Sorry, everyone, I'm having mic issues. Can you hear me? Okay, this time I'd like to turn it over to Health Director Gibbie Harris. Gibbie.
Thank you. Good afternoon, everyone. Thank you for joining us this afternoon. I have with me Dr. Meg Sullivan, our Medical Director for Public Health. Both of us have a few initial statements that we'd like to make, information we'd like to provide, and then we will open it up for questions. So as you know, our metrics are continuing to trend up. They're not moving quickly, which is good news. And we are not seeing huge increases in hospitalizations at this point, which is also good news. But we do know that they are seeing some trends upward in our hospitals as well as in our intensive care units. So something that we need to watch very carefully. Our percent positivity rate continues to climb a little bit, as well as the number of cases that we have in the county each day. So again, watching that very closely. If you've been paying attention to what's going on nationally, there are communities that have started to see or have already seen spikes in cases and in hospitalizations, as well as in deaths in those communities. We are hoping not to see that here. A lot of that is being attributed to some of the variants that are out there, and in some cases, the variants are the primary source of COVID at this point. We are also seeing that 12 to 17-year-olds are being more affected by some of the variants. So again, something else that we need to watch very closely in our community as we move forward. I think the main thing that we need to pay attention to is that people are still becoming ill from COVID, and people are still dying from COVID in our community as well as in others. We mentioned, I guess, several months ago that we were on track for COVID to be the third leading cause of death in 2020 in our community, and that has played out across the country. CDC has announced that as well now, that COVID has become the third leading cause of death in 2020. So we do know that we're continuing to see deaths. That's not acceptable, especially if we have a way to prevent that from happening. So we need people to continue to wear their masks, socially distance, and try to avoid large gatherings. But we also need people to get vaccinated. Everyone is eligible now. Everyone 16 and older are eligible for the vaccine at this point. And so we need people to make the effort to get vaccinated. It's worth it. It's worth it to you. It's worth it to the individuals around you, those you love, those you care about, those you work with. But it's important to our entire community if we are going to be able to continue to open up and try to normalize things a bit. So again, just wanting to encourage people during this National Public Health Week, number one, to do the things that public health has been telling you to do for the past year, that will protect our community and help us become a bit more normal again. And I also want to suggest that if you know someone that works in public health, this has been a difficult year for all of us. But our staff here in Mecklenburg County have worked tirelessly for the past year to do everything they can to help protect our community and to help us be as safe as possible. So if you know somebody that works in public health, please give them a little shout out. It would be greatly appreciated. So now I'm going to turn it over to Dr. Sullivan.
Thank you, Gibbie. And I think I'll just follow your advice first and give you a shout out for the amazing work that you have done over the past year. And now I'll just provide a brief update around vaccinations for Mecklenburg County Public Health. So to date, we have administered over 80,000 doses of the COVID vaccine through our fixed site locations, our community clinics, and now our homebound vaccination program. We have also transferred over 35 doses to our community partners as part of our efforts to ensure equitable access to the vaccine throughout our entire community. As Gibbie mentioned, we are excited that as of yesterday, all of Mecklenburg County residents ages 16 and older are now eligible to make an appointment for the vaccine. And we will continue to offer appointments through our hotline, through starmed.care, and at specific community sites, and really continue to strongly encourage everyone to get vaccinated, especially as more and more appointments are becoming available in the community. Just to also kind of talk about National Public Health Week, I wanted to just take a moment to summarize the work that Mecklenburg County Public Health, the COVID vaccine team, is doing in the community this week alone. So in addition to our appointments at Bojangles and Medic, we have been working with our shelter and jail staff to offer the vaccine at 12 different shelter locations and at the Mecklenburg County Jail. We also have first and or second dose clinics at CPCC, Davidson, Huntersville Recreation Center, Pleasant Hill Baptist Church, Smith Family Wellness, the Latin Community Credit Union, Camino Community Center, the courthouse, the sheriff's house, and homebound individuals' homes. We also continue to work to directly engage with community leaders and partners to ensure accurate information is widely disseminated in multiple languages through various channels about the 3 safe and effective vaccines that are currently available in our community, and are continuing to plan future clinics, including a large community event at Camp North End next weekend, and continuing to expand our homebound delivery of vaccines in partnership with Medic, Fire, and Emergency Management. I think this work this week just presents a small snapshot of the nonstop hard work of the public health staff and our constant focus on health equity. And I'm incredibly proud of the work of our team and the entire department. I also just wanted to take a moment to highlight some of the recent data that has come out that reinforces the safety and efficacy of the 3 available vaccines. So the CDC recently released data that showed the real world effectiveness of the vaccine among almost 4,000 healthcare personnel and first responders who had received at least 1 dose of the vaccine and were tested weekly for the COVID infection, and found that those who were fully vaccinated had a 90% reduced risk of testing positive, which I think is just really remarkable. In addition, we learned about data from ACOG among pregnant and breastfeeding women who had received the vaccine, which demonstrated a strong immune response among pregnant women with no significant safety concerns, and the fact that evidence of antibodies or protection being passed to infants through the umbilical cord and through breast milk. We also heard about data from the Pfizer clinical trial among 12 to 15-year-olds that showed 100% effectiveness in preventing COVID among that age group, which increases the optimism that a vaccine will be available in that age group in the near future. And then finally, we've heard data from both Pfizer and Moderna that shows efficacy is lasting at least 6 months, and we expect that data to continue to show longer term as well. So all of this data and more continue to reinforce that the vaccines are safe, they're effective, they save lives. As Gibbie also mentioned on a more sobering note, we know that the COVID was the 3rd leading cause of death in 2020, and we continue to see more deaths. So in addition to continuing to adhere to the prevention measures that we talked about, it is really important that everyone get vaccinated to protect themselves, their family, and the community. Thanks.
Okay, today's first question is Derek Dellinger, Fox 46.
Thank you for taking my question. First round of questions, actually, in regards to the doses that were administered at Bojangles Coliseum. We know that there were, I think, 5,000 doses that were made, or 5,000 appointments or doses that were being made available. Have they all gone? And are also, if they haven't, are you anticipating them going by quickly?
Yep, so I think what your question is referring to is yesterday we opened up appointments for April 14th through the 19th. The exact number of appointments was, I think, closer to about 3,000. As of this morning, those appointments have all filled. And again, that's something that we monitor, and we work on opening up additional appointments as vaccine supply allows, but those appointments right now, as of this morning, were filled. That being said, we do know we have many community partners who are offering lots of vaccines. We're continuing to make appointments available. So for individuals who are not vaccinated, remember, everyone over the age of 16 and older is now eligible, and we encourage people to continue to work to make appointments.
Next question is Belen Gomez-Jordana.
Thank you for taking my question. I'm with Telemundo Charlotte. I'm not sure if I can make a couple of questions in Spanish to Dr. Sullivan.
Sí.
Gracias. Mi pregunta es, acaban de decir que están contentos porque ayer se abrió ya todo el mundo el proceso de vacunación, ¿verdad? A mayores de 16. El problema que hay entre la comunidad latina es que desconocen que la vacuna Moderna no es aplicable para jóvenes de 16 años. No sé si han visto algún caso de aquí en adelante que jóvenes de 16 se hayan vacunado ya de Moderna sin tener que hacerlo, y si hay algún tipo de excepciones en jóvenes que pudieran usar esta vacuna. Gracias.
No, gracias por esta pregunta. Yo pienso que eso es una cosa muy importante, que decimos que gente más de 16 años ya pueden recibir la vacuna, pero jóvenes que tienen 16 o 17 años deben recibir la vacuna de Pfizer y gente más de 18 años pueden recibir cualquier de los tres. So, otra vez, no hay como una excepción de esto, pero lo que dice el CDC es que si un joven de 16 o 17 años sí recibe la vacuna de Moderna por accidente, entonces todavía pueden recibir la segunda dosis si quieren, pero de veras la gente que tiene 16 o 17 años deben recibir la vacuna de Pfizer.
¿Cómo está trabajando el condado? Disculpe otra pregunta. ¿Cómo está trabajando el condado para dejar saber a las personas qué vacuna están poniendo? Para evitar así que jóvenes de 16 y 17 años ocupen una posición, ¿verdad? En vez de dejarla libre cuando no pueden vacunarse.
Sí, yo pienso que hay algunas cosas que son importantes. La primera es para estar segura que hay información disponible en todo el condado que dicen que sí, toda la gente que tiene más de 16 años ya pueden recibir, pero también que gente que la edad de Johnson & Johnson y Moderna es más de 18 años. La segunda es decimos a toda la gente que tenemos 3 vacunas que sí son seguras y sí son efectivas y deben hacer una cita y reciben la vacuna que está disponible. Pero eso es diferente para los jóvenes de 16 y 17 años. Si están haciendo una cita, deben asegurar que la cita es para la vacuna de Pfizer, porque si va a su cita, la tercera cosa que estamos haciendo, yo sé que en el condado y me imagino que todas las clínicas están haciendo eso, es necesita chequear la edad. Y si tenemos algunas personas que vienen a una clínica de Moderna o de Johnson & Johnson, que son 16 o 17 años, vamos a decirle no pueden recibir, pero vamos a ayudarle a hacer una cita de Pfizer.
Thank you.
Next question is Chloe Leshner, WCNC.
Hi, everybody. Just wondering how you have seen supply grow this week. Are you expecting that to continue to go up? It just kind of seems like for the first time, there's actually appointments to choose from when people are looking to make one.
Yeah, we are continuing to see an increase in the availability of vaccine, but we don't know from week to week what that's going to look like. We anticipate, based on what we're hearing from the federal government, from the state, that those doses will continue to be made available and will expand over time. But again, we continue to have to look at that from a week to week basis to know what we can anticipate the following week. So we're hoping for more vaccine. I think that the appointments are more available than they were, but we're also seeing maybe a tipping point where we're moving from demand outpacing supply to supply and demand sort of balancing out at this point. So again, we'll have to stay on top of that, but expecting more vaccine.
Next question is Alison Kuznitz, Charlotte Observer.
Dr. Sullivan, it's Alison Kuznitz from the Charlotte Observer. Could you give more details about the vaccine clinic at Camp North End, what days that will be available and how many appointments? And can you also talk about how public health has maybe rethought the vaccine waitlist now that just everybody is eligible? How are people prioritized? And should they be expecting a call not only from public health, but from also the community partners throughout the county?
Yeah, thank you for both of those questions. So the first question about Camp North End, it is going to be next Saturday, April 17th from 9 a.m. to 4 p.m. We are waiting to announce the exact number of appointments until we receive we still don't know our exact allocation of vaccine for next week. We are hoping to make it large, but we'll be providing more information in the coming days once we know our allocation. The second question about the wait list, I think it's a really great question. So we are, again, encouraging everybody who has not yet been vaccinated and who is eligible, so ages 16 and older, to be making appointments. And if individuals can't find appointments, we absolutely want them to join our wait list. Depending on the size of our wait list, we have been working to prioritize, especially based on age. So still understanding there are individuals over the age of 65 who are at higher risk of complications. So we've been working to get them appointments and making any accommodations that they need for those appointments, and then based on risk of exposure. But I think that's something we constantly reevaluate. And as more availability becomes, as there's more appointments that are available in the community, the need to prioritize our wait list might go down. And really, it's just going to be about really encouraging people to get vaccinated and get an appointment.
Next question is Paige Hopkins, Axios, Charlotte.
Hey everyone. I know the county has talked about before how sometimes the data shows Mecklenburg County as being behind other large counties with number of vaccinations, and some of that is because of out-of-county residents coming and getting vaccinated here. I'm wondering if there are any other reasons why the data shows that, and is it frustrating that, you know, the number of people being vaccinated here isn't necessarily reflected in some of that state data?
Yeah, that's a great question, and there may be multiple answers for this, but the main thing that we think contributes to that is the fact that we're not just focused on vaccinating those who live in Mecklenburg County, but those who work in Mecklenburg County. And there are a lot of people that come into our community to work every day. We want them vaccinated as well because their potential exposure, just like the folks that live here. So we do know that quite a few of those individuals have been vaccinated here in Mecklenburg, and they don't count in our numbers. So we anticipate that continuing. And in the beginning, when vaccine was really pretty scarce, we did see a lot of people coming from other communities just to get vaccine because we had vaccination clinics here. That is changing some and starting to shift. So we're starting to see our percentages slowly starting to catch up with other parts of the state who did not have some of those issues to deal with as much. But obviously, the numbers that we're seeing so far are not the numbers we want to see. So we are still working hard with all of our partners to get as many people vaccinated here as we possibly can, and hope to see those percentages increase as the weeks go on.
Next question is Derek Dellinger, Fox 46.
Thank you for taking my question again. There is a CDC report that's going to be released a little later on today that actually had some involvement from Davidson College. And the basically bottom line here, it's specifically related to colleges and universities. And the bottom line on this research is basically saying that colleges, most colleges nationwide, are not able to test students at a level that is good enough to prevent COVID-19 spread on campuses. I'm interested in getting your thoughts about it, and basically what colleges and universities have been doing here locally. Do you feel that it is sufficient? Do you feel like there should be more that needs to be done, at least on those levels? Because, I mean, for lack of better words, these are congregate facilities, at least in some circumstances here. You're going to have a lot of students around in a certain place. I'm interested in getting your thoughts basically on what you are seeing locally, because nationally it's one thing, but locally, some of these colleges and universities are saying they're doing a good job, but from a public health perspective, how do you feel that they're doing?
That's a great question too. We have worked very closely with the universities and colleges here in Mecklenburg County, and I'll have to say that they have been very careful to make sure that they've got the resources that they need to be able to test regularly on their campuses, and have been able to catch cases before they become outbreaks on a regular basis. We've been very pleased with what we've seen working with our universities. UNC Charlotte has done a great job of monitoring, testing, isolating, quarantining, handling all of that very well. Davidson has done the same. So we are pleased with what we've seen with our universities so far, and the fact that they have been really good partners with us since the beginning of this pandemic.
Hey, this is Chloe with WCNC again. I just wanted to clarify with some of that state data. Does it reflect who is vaccinated in the county, or how many people who live in Mecklenburg County who have been vaccinated?
It demonstrates how many people who live in the county have been vaccinated. We do not get the quote unquote credit for those folks who live outside the county, work here, have come in to get vaccinated, or others who have come into our community to get vaccinated. The ones that you're seeing in those statistics are individuals that live in Mecklenburg County.
Maybe it's Alison Kuznitz from The Observer. Could you talk about, as our hospitalizations might be trending upward as we saw in other communities, would you estimate that we would get to a point that looks similar to, say, the July surge? I mean, kind of where would you pin us between the July surge, Christmas surge? How high could this get?
That's a tough question. It could get as high as the July curve. We're doing everything we can, and we hope that individuals in our community are doing everything they can to prevent that from happening. So far, we haven't seen anything that is showing us that we're going to get to that level again. As I mentioned, our numbers are increasing, but they're increasing at a very slow pace. And with the reopening, we expected to see some additional cases. So hopefully that's what we're seeing at this point. Hopefully we're not going to see any kind of surge or additional numbers of cases out of spring break. We're just going to have to wait and see on that. So yes, it could potentially go there, as we've seen it happen in other communities across the country. But we right now are trying to be cautiously optimistic that between the efforts of all of the individuals who are providing vaccine in this community, as well as all of the work that everyone is doing to take care of themselves and to take care of others, that we're not going to see that. So we have the potential of keeping this rather flat right now, but it's up to all of us to make that happen.
It's Derek with Fox 46. A question real quick about the B117 variant. I think I saw a story yesterday that basically said that this was the most dominant one that is basically for the cause of new cases. Here in Mecklenburg County, I mean, can you talk at least to the variant, the exposure of the variant here in Mecklenburg County?
Unfortunately, we don't have good data on a county level that shows the amount of cases that are due to the different variants. What we do know is that we have seen variants in this county with some of the surveillance testing that's been going on. So we do know that it's here. At this point, we just don't know how much those variants are contributing to the new cases that we're seeing.
Next question, please.
Hey, this is Chloe again. Just wondering, are there any groups, maybe age groups, certain populations that you are seeing not wanting to get vaccinated that you're concerned about? And then what specifically is the county doing to really target those groups and encourage them to get vaccinated?
Yeah, I think that's a great question. And I think sometimes it's a little hard to analyze the data right now just because of the priority group. So again, we've seen a larger uptake in the older population, which is really great. But understanding that for some others, they just became eligible yesterday. And so I think that's something we're going to be watching really closely, in particularly kind of in the younger adults, and to make sure that we're seeing or trying to see higher uptake among all of the populations. I think especially as we talk about more vaccine becoming available, everyone now is eligible. Really, our focus has been on getting out in the community, making sure there's accurate information out there, providing vaccine in the community, but recognizing, kind of doubling down on those efforts now and really trying to go out and reach everybody to address any concerns or questions they may have, and to reinforce the data that just continues to come out around the safety and effectiveness of these vaccines, and B, the importance of these vaccines for themselves, their families, and the community. And so I think that the efforts that we've been doing, it's really just going to be really, really, really reinforcing those and increasing them in the community.
It's Derek with Fox 46 again, and I want to get something clear here before I actually ask this question. As far as the federal pharmacy stuff, basically the people that are getting vaccinated through Walgreens, is that being reflected in any data that you are getting, or how often are you getting that data, if at all? You're muted, Gibbie.
Meg, do you want to?
Oh, no, we were just saying you're on mute.
Sorry about that. I've got to do that at least once in every meeting, is to keep myself muted.
Okay.
What we're understanding right now is that the data from the federal programs in the pharmacies is not being reflected in our county data. So that also contributes to the fact that our numbers are not what we would like them to see. We know they're higher than what we see in the state data, but we don't know how much more they are. So all of those individuals who got vaccinated in long-term care facilities, the staff that work in long-term care facilities as part of that program are not counted in this data. And those pharmacies that are getting federal allocations directly are not reporting data into the state system either. The pharmacies that are getting vaccine through the state, through us, that is reflected. So those numbers are a little bit off to begin with.
Okay, so that being, I mean, I'm hearing anecdotally, I'm hearing from family members, I'm hearing from people on the street, I'm hearing from coworkers, but it's like, hey, we can finally get the vaccine. We're going to go get the vaccine. I've got my appointment, or I have already got my shot, or both of my shots. And so, and a lot of them, let's be honest here, have been through Walgreens as far as that program is concerned. How, I mean, level with me here. How frustrating is it to not exactly have that information? Because I would assume you want to have that information. You want to be able to accurately reflect this, but you can't get a hold of that information right now.
It is frustrating. It makes it difficult for us to paint an accurate picture here in Mecklenburg County. We put data out all the time, hoping that it's as accurate as it can be. But the challenge has been from the beginning with the systems that are in place to track vaccine. The system is a state system. We can only get the data out of it that they make available to us, and then the federal data is not available at all. So what we're giving you is the best we have. Unfortunately, it's not everything. And so we all have to sort of keep that in the back of our minds when we think about how many people are actually vaccinated in the county.
Next question, please. Do we have any more questions today?
Gibbie, it's Allison again. Could you talk about that discrepancy some more? Because I'm seeing on the dashboard, it does say now NC providers, federal pharmacy partners, and all programs. So does that all programs that still does not include vaccinations done at CVS and Walgreens and other places like that?
The one that I'm not 100% sure of is whether they have included the data from the initial federal program when they were vaccinating long-term care facilities. I don't know if that data is included in there or not. And, you know, what we'll need to do is look and see exactly when that information started becoming available and how far back they went. I'm not 100% sure about that. But you know, the challenge is the information is coming out of the state system and we get what we get. So we're not able to do as much as we'd like to with the data to be able to describe the picture fully here in Mecklenburg County.
Next question, please. Do you have any further questions today? Last call for questions. Okay, thank you very much, Director Harris and Dr. Sullivan. Everyone have a great afternoon.